Good afternoon, everyone. Thank you for joining us at this news conference on Thursday, August 5, to discuss the state's next emergency proclamation relating to COVID-19. Governor Ige will be joined today by Dr. Elizabeth Char, the Director of the Department of Health, Mayor Derek Kawakami from the County of Kauai, Mayor Rick Blangiardi from the City and County of Honolulu. Mayor Victorino is traveling, but we may have him online for Q&A. We'll play that by ear. Mayor Mitch Roth will be joining us, and Keith Hayashi, the interim superintendent of the Department of Education, will be here as well. So with that, Governor Ige.
Thank you so much for joining us here this afternoon. You know, a few months ago, we were proceeding and progressing very well in our fight against COVID-19. Vaccination rates were very high here in Hawaii and going strong. The number of COVID-19 cases were shrinking as our entire community responded to the actions needed in order to slow COVID-19 here in Hawaii. Since then, much has changed. Today, the number of cases and hospitalizations are all trending up dramatically. The highly contagious Delta variant creates a big risk of infection, especially for members of our community who are not vaccinated. Based on the current conditions, I must take action to protect public health and avert unmanageable strains on our healthcare all across the state. Today, I'm signing an emergency proclamation that requires all state and county employees to provide their vaccination status to their department, office, or agency. If they cannot provide proof of vaccination by August 16, they will be subject to regular COVID-19 testing. If a free testing site is not used, employees must pay for the testing, any testing costs. In addition, they may be subject to travel restrictions moving forward. As a reminder, state employees have been granted administrative leave to get vaccinated during work hours. The mayors and I agree that this new vaccination and testing policy for state and county workers will help to protect the health, safety, and welfare of the people of Hawaii. Just a couple things on the emergency proclamation that I'm signing today. It continues the statewide mandatory mask mandate for indoor public settings. And I certainly would encourage you strongly to wear a mask outdoors if you are in a large group or unable to maintain physical distancing. The proclamation also continues the mandatory travel quarantine and the Safe Travels program, including the pre-travel testing requirement and the vaccine exceptions to quarantine. The proclamation also continues the suspension of licensing requirements for select medical and healthcare professionals that meet certain conditions. This allows us to address staffing needs in our hospitals and healthcare clinics all across the state. The proclamation also allows boards and commissions to continue to meet virtually using interactive teleconference technology. It allows the extension of the expirations of driver's license, state IDs, and instructional permits that expired during the emergency period. All of those with expired licenses and IDs will have additional time to update their driver's license and IDs. As you know, there has been much said in the news about the eviction moratorium. Our proclamation does end the state's eviction moratorium, as announced 20 days ago. For those who are behind in their payments and landlords who may have a tenant who is behind, strongly encouraged to seek rental assistance that is available in every county all across the state. This, we do not know what the impact of the federal eviction moratorium would be. We continue to work with federal agencies and here in the state to determine what the impact of that federal CDC eviction moratorium will be. So I really want to ask everyone who is not vaccinated to get vaccinated as soon as possible. This is the best way for us to keep our community healthy and safe. Every one of us can make a difference in getting our schools back to in-person learning to keep our communities healthy and strong. Get vaccinated, stay home when you're sick, and keep your children home if they're sick. Get tested for COVID-19 if you have symptoms. Wear your mask indoors and outdoors if you're in a large group or gathering. Wash your hands frequently or use hand sanitizer. Taking these simple everyday actions, if all of us do it, helps us fight against COVID-19. Thank you.
Dr. Char?
Hi, good afternoon. The number of people with COVID-19 infections has increased dramatically in the past few weeks. Today, we report 655 people newly infected with COVID. This is the highest single-day count since the beginning of the pandemic. We're seeing widespread community transmission along with clusters in groups of people who are unvaccinated. And we're seeing infections in people who've been in close contact, often indoors, without wearing masks. This alarming rise in cases will not end on its own. Our hospitals are concerned about their capacity and especially their staffing. The return to normalcy we were all fighting so hard to attain is now in jeopardy. The good news is that we know what works. We have the tools that we need to slow the spread of COVID. This will require a whole of government response and participation by the entire community. All of us need to do our part. Please wear your mask. Stay home if you're sick, even if you think it's just your allergies acting up. Avoid gathering and get vaccinated. We will get through this and we will do it together if we all do our part. Thank you.
Our next speaker will be Mayor Derek Kawakami. Mayor?
First and foremost, we want to thank our community for their patience and understanding as we navigate through this challenge. We're back in a place where we have to adjust and pivot very quickly. Many of us didn't anticipate the impact that this Delta variant would have on our communities. Some level of government intervention at this point in time is necessary. And quite frankly, the business community and our community partners have tried to do everything to get us to a point where people could return to work. I do want to thank our workers at the County of Kauai for their tremendous dedication throughout this pandemic. Right now, what the governor has proposed is something that we can agree to and support. It gives our workers choices to either opt in to vaccination, which I strongly suggest, or opt into testing. There are many moving parts to make sure that we can operationalize this task. And so we'll be answering questions as we figure things out rather quickly. But I will tell you this, that we intend to make this as easy and convenient as possible, because bar none, what works is vaccination, early detection through testing, and wearing masks. So we are all going to be doing our part to be able to move forward towards normalcy. So that being said, we look forward to working with everyone. We encourage all of our associates, whether they're vaccinated or not, to go get tested regularly. This Delta variant is very contagious, but we are very optimistic and confident, as always, that we'll move through this challenge. So thank you.
Thank you, Mayor. Our next speaker is Mayor Rick Blangiardi, City and County of Honolulu. Go ahead, Mayor.
Thank you. Good afternoon. Look, I'm here to really make a statement of support of what the governor has said and for the reasons why. I think Dr. Char and the governor have made a really strong case as to why we're taking the actions we're taking. That said, our goal at the City and County of Honolulu is to have all of our employees vaccinated. And so there's a small caveat here in how we intend to operate. And that is that we're going to require vaccinations, except for because we recognize that people either have a medical reason and or a religious belief, which we're going to require affidavits for. In that way, we think it's a better protective measure so we can work with that subgroup on testing. But our end game right now is to have all of our city and county employees vaccinated with those exceptions being made. So we're here today to support. I also want to echo what Mayor Kawakami just said and thanking the community at large for a really great effort. But we're in a different place now as a result of the infectious nature of this variant, and we want to deal with it accordingly. So thank you very much.
Thank you, Mayor. Our next speaker is Mayor Mitch Roth from the County of Hawaii. Go ahead, Mayor Roth.
Aloha. It was our sincere hope that we wouldn't have to come down to this to get people to do the right thing for the community. We understand that people have moral values, but some people are uncomfortable with the idea that people are opposed or are scared, that people flat out just don't trust the science. Unfortunately, our hospitals are filling up. Our ICU beds are at capacity. This virus, and particularly the Delta variant, is incredibly transmissible. It can affect everyone, including our youth. It's no longer just the kupuna, it's everyone. We want to return to our fields and gyms to get kids back in classrooms without distractions or masks, to allow folks to see our smiles again. It's been over a year since we had the chance to have baby luau's and large weddings. Enough is enough already. Let's get back to the things we love most by taking the vaccine, limiting gatherings, and wearing our masks. The time is now. I want to thank those members of the community that have gone out of their way to be responsible and do the right thing. At this stage, we need to get vaccinated. We need to get back to normalcy. Thank you.
Thank you, Mayor Roth. Our final speaker is Interim Superintendent of the Department of Education, Keith Hayashi. Mr. Hayashi.
Good afternoon. The Department of Education has more than 22,000 salaried employees and another 20,000 part-time and casual workers, making us the largest state agency. We are fortunate to have our staff prioritized for vaccines as frontline essential workers back in January, giving our teachers, bus drivers, custodians, and other team members early access to vaccinations. We encouraged everyone willing to be vaccinated to take advantage of the early access and use surveys to determine demand. We know how critical vaccinations are in the fight against COVID and our commitment to ensuring safe and healthy environments for all of our students and staff. Today is day 3 of the new school year, and most of our students are back on campuses after spending much of the last 17 months away from school. As a department and as a state, we have prioritized reopening our schools for in-person learning. We want to be sure our students can continue to benefit from in-person learning. As part of that commitment, yesterday, we made a tough decision to delay the start of our fall athletics season to allow time for student athletes and athletic staff to get fully vaccinated. Today's announcement by the governor and our mayors will help further protect our schools and communities. Mahalo.
Thank you, Mr. Hayashi. We now have media questions, and reporters, if you could please remember to ask or let us know to whom you are asking your question. So we'll go ahead and start with Dan Nakaso at the Star Advertiser. Go ahead, Dan.
Thanks, Cindy. Questions for Governor. I want to make sure I understand the August 16th deadline. So if you're unvaccinated, you wouldn't be able to get the 2 shots protocol by then. Does that mean if I get a shot, then I also have to prove negative tests? And secondarily, do you have any estimate how many county and state employees may possibly be unvaccinated and facing these new requirements?
No, we don't have a specific number. We have done surveys of the various agencies, and some of the other mayors might have specific numbers. I know that we don't have specific numbers for the state employees. We believe, yes. So Dan, if someone
Sorry. Max Dybel, go ahead, Max.
Cindy, I'm sorry. The audio cut out on the governor. I didn't hear that answer at all. Am I the only one? I can hear you, Cindy.
I do not know the answer to that.
He was not the only one. I also could not hear it, so I can wait on my question until.
Okay, can you guys please just give us a couple of minutes?
Yeah.
Hold on,
Okay, do we
do sound is back?
can test?
Okay.
Can you hear me?
I can hear you now, Governor.
Okay, so Dan, the question was, what would happen if an employee initiated vaccinations between now and the August 16th date? Yeah, so for those who are fully vaccinated, they can provide a verification. For those who initiate the vaccination protocol take the first shot, then they can provide proof that they started and took the first shot. When they completed the vaccination protocol with the second shot, then they could provide verification that they are completely vaccinated.
Sorry, Max. So does that mean they also have to take the test after they take the initial shot, and then they have to prove a negative test?
Yes, they would have to get tested and submit their negative test result.
Thank you, Governor.
Okay, thank you, gentlemen, for your patience. We'll go to Max.
This is also for the governor. Are there any circumstances under which any of these employees in question could fail to comply to a point that they would lose their jobs?
Certainly we are working through the details but by all of the employers. There would be due process, but clearly if someone did not provide or get vaccination, then they could be subject to termination.
Thank you, Governor. Wendy Osher from Maui Now.
Hi, this question is for Dr. Char. State health officials on Maui spoke recently at a community meeting saying they anticipate this current upward trend in new cases to peak at around 250 daily cases for Maui in about 3 weeks. Is this in line with your estimates? And at one point, do our healthcare facilities become taxed, especially on the neighbor islands?
I'm not sure exactly what Maui will peak at. I haven't done calculations specifically for that. We'll talk to our data folks and get back to you on that. I think the concern is statewide with regards to the hospital capacity, and really more than the capacity, it really is about the staffing levels. The hospital folks have been working tirelessly, and we have to realize that it's not only COVID. The majority of the hospital beds are filled with non-COVID patients, but the COVID patients take particular attention, and it's just an added task on top of taking care of the other patients, where you have to really suit up in PPE and whatnot. So it's just been really tough on the hospital systems, and we see the numbers going up. So we're anticipating it's going to get worse before it gets better. And we want to make sure that we have good capacity in the hospitals so that we can take care of everybody who needs to be in the hospital, who needs care, whether it's COVID or not. So that's why everybody's being quite proactive with regards to the hospital capacity. Certainly all the hospitals, and especially the Healthcare Association of Hawaii, has been a really good partner in that end.
Thank you. Manolo Morales, please go ahead.
Thank you. This is for the governor and possibly the mayors. Some of the public workers unions are already saying they plan to fight this and they plan to file a formal complaint with the labor board. Are you confident that this can go through without getting stuck in this legal lock for any reason?
Certainly we are committed and prepared to proceed. We do understand that the unions will exercise their rights to challenge the decisions made. And we are prepared to defend the state's action, the state and county's action as part of our response to this emergency pandemic.
Okay,
I don't know if any of the other mayors would want to respond to that.
mayors?
I'll just offer in City and County of Honolulu, we feel our legal position is correct.
From the County of Hawaii, one of the things that I've heard from a lot of union workers is, I would say the majority of our union workers are already vaccinated. And they're kind of upset and asking why aren't these other people who they have to work with get vaccinated. So not sure where the union goes when the majority of their employees are already vaccinated.
Okay, thank you. Next reporter is Daryl Huff, Hawaii News Now. Go ahead, Daryl. Daryl? All right, Daryl, we can't hear you, so we're going to go ahead. We'll go ahead to Jen Kelleher from the Associated Press. Go ahead, Jen.
Hi, this message is for the governor. I'm wondering about lawmakers. What message do you have for lawmakers who refuse to get vaccinated, especially those in areas where vaccination rates are low? And any sense of how many lawmakers are refusing to get vaccinated?
Yes, thanks for that question. I'm not aware of any lawmakers in Hawaii that is not has not gotten vaccinated. I do know that they were part of an early priority group, and the Department of Health did have vaccination clinics for legislators as well as staff here at the state capitol. But I don't have any specific numbers. I'm not aware of any lawmaker in Hawaii who has not been vaccinated.
Okay. Thank you. Next reporter, Nicole Tam. Go ahead, Nicole. KTV.
A clarification question, also a question for Mayor Blangiardi. My clarification question is for the frequent testing for people who are not vaccinated. How frequent is that testing? And the question for Mayor is, a lot of people have been asking us if you would move back tiers because of the surges in cases on Oahu.
Well, since I'm up, I'll just answer. We have no intention of moving back tiers. We have a conversation tomorrow about the size of gatherings. We're going to defer any comments till we all get together with the governor on that. But at this point right now, our thrust and focus is on vaccinations and getting as many of our employees, and for that matter, encouraging the rest of the people outside of the employees of the city and county to be vaccinated. So that's where we're at right now. We believe that's the best remedy. And at this point in time, we're going to put out an all-out effort to make that happen.
Thank you. Next reporter is Kevin Dayton from Civil Beat. Go ahead, Kevin.
I'm sorry. I was hoping that the governor could answer that the second question that was just posed to him, which is how frequent the testing would be. And then I have another question, of course.
Sorry, for those who are not vaccinated, the testing requirement would be once per week.
Okay, thank you. And Kevin, you had another question?
I do. I guess this is for Dr. Char. I'm interested in the latest data on what fraction of the people who are testing positive in new cases now are unvaccinated. I think we've heard a couple of different numbers.
The most recent number I heard was that 95% of the cases of the people who are testing positive for COVID are unvaccinated. I think we've had numbers between 95 and 97%, but I think it's clear that the vast majority of people coming down with COVID-19 right now are unvaccinated. The vast majority of people in the hospital are unvaccinated.
And doctor, that would be for Hawaii, those statistics?
Yes, correct. That's for the state of Hawaii.
Thank you.
Thanks, Kevin. We're now going back to Daryl Huff, Hawaii News Now. Go ahead, Daryl. We're still not hearing you, Daryl. All right, so we will come back to you again. All right, Stephanie Salmons, go ahead, please.
Hi, this is for Dr. Char. What else do you think needs to be done to further drive vaccine efforts in the state? You know, what needs to be done to get the remaining unvaccinated people access, get them vaccinated, I guess, and what so far has been working and what hasn't worked in terms of vaccination efforts?
That's a great question. I think we have been focusing our effort on finding out why people are not getting vaccinated. Sometimes it's related to misinformation. So we're trying to correct that and give people sound information upon which they can base their decisions. In other cases, it turned out that it was access. And so we have really been doing focused outreach into the community to provide vaccination sites, you know, really close to where people live or work or whatever, and just make it easy for them. Some people have really busy lives and are juggling childcare and work and whatnot. So the easier we can make it, the more likely they are to get vaccinated. There's a subset of the population that just is not interested and will probably never get vaccinated. But to the extent that we can identify people who have not yet been vaccinated, we're just trying to figure out why. We encourage them to ask questions. We're trying to provide good information, access, outreach, education, and make it as easy for people to make their decisions as we can.
Okay, thank you. Reporters, we're going to try Daryl one more time before we start going back through. Daryl Huff, can we get you on the line? All right, not hearing him yet. Daryl, can you just text me your question, please? And we're going to start through again. Max, you had another question, Max Dybel?
I did, and this could be for the governor, perhaps Superintendent Hayashi, or even Dr. Char, so whoever wants to take it. You know, with this unprecedented surge going on and no sign of it turning around, it's only getting worse. How do you justify sending kids back to school, not delaying it just a little while? You know, if you're bringing 180,000 people back together, some of whom aren't eligible for vaccination, you know, I know that there's the safety protocol built in, but there's not a lot of mandates in there. There are suggestions, encouragements. So without more mandates and stricter rules, how is it possible that this doesn't spread the Delta variant to every corner of the state?
Yeah, that's certainly, I'll start, and Superintendent and Dr. Char can certainly add. But we have seen all across the country that schools have been able to reopen for in-person learning in a safe and healthy way. The actual number of clusters or outbreaks that has occurred in the school setting has been limited here specifically in the state of Hawaii. And as you look at the experience across the country, it's been very limited. You know, the sense is that, one, we do know that our children benefit greatly from in-person learning. That's the best opportunity for our students. We know that so much of the learning occurs in that interaction between other students as well as the teacher in the classroom. And so clearly we are all committed to returning our students to in-person learning here all across the state. And we know that our schools have gotten better at implementing the layered mitigation actions of cohorting students, minimizing interactions between the broader community within our school campus, keeping students in bubbles and clusters to limit the spread. And we do know and have experience through our summer program, as well as the schools that are on the year-round calendar, that our educators and staff at the schools have been successful in implementing the mitigation strategies and reducing COVID-19 infections.
Okay, thank you, Governor. You can stay there because we did get a text from Daryl Huff, Hawaii News Now. He would like specific details on how exemptions will work. And he's asked be very specific, and how can people be forced to pay for tests if they are insured?
Yeah, certainly for those who have insurance, the Department of Health has posted a link on their website. We are providing free access to testing. The federal government has provided free access to testing on specific providers here in the community. So we are confident that there will be access to a test for any state or county employee should there need one. Darryl, we can provide more specifics on the exemptions that will be allowed. That is part of the details that we'll be working through.
Thank you, Governor. Manolo, you're next. Please go ahead.
Okay, this is also for the governor, sorry. Just going to follow up on that previous question. Do you expect a surge in people applying for these exemptions because of this? And also with UH games, football and volleyball games coming up, what sort of protocols are going to be in place for the fans?
I anticipate a surge in people getting vaccinated. I think that would be the best outcome for our community and all the people of Hawaii. Certainly, there will be some that would seek an exemption, and we'll deal with those that seek an exemption. In terms of University of Hawaii sports, we are working with the university and the city and county of Honolulu, actually, to establish protocols so that fans can get back to watching games as appropriate. But we want to emphasize that the Delta variant is very different, and we want to be able to establish protocols that would allow spectators to be in a safe environment.
Okay, thank you very much. Jennifer Kelleher. Jen, go ahead, please.
Hi, this question is for the governor. From what I understand, federal properties are exempt from your indoor mask mandate. If that's accurate, what efforts or conversations have state officials had with the federal side regarding masks, reducing crowds, vaccinations, considering we have such a large federal and military presence here?
Yes, my information is that the federal government did follow the CDC guidance when they had announced that vaccinated individuals would not be required to wear masks indoors. We have been in communication with the federal government. They informed us that they would be following the state's lead and require everyone to wear a mask indoors on the federal properties.
Thank you, Governor. Kevin Dayton, go ahead, please. Kevin?
Yes, thank you. Sorry about that. Governor, can you tell us, update us on what's the status of the state's efforts to distribute emergency rental assistance to qualifying landlords and tenants? And do you know how much money has been distributed so far and how much is still available?
Yeah, and I will turn that over to the counties. The state did run the program last year with the CARES Act funds. We did distribute funds to the counties, and the counties also received funds directly from the federal government, I believe, for rental assistance. And so I'll turn it over to the mayors if they can provide an update on the rent relief.
Mayor Blangiardi?
I think one of the things we're really proud of, we haven't really made much of it publicly, but our rent and utility relief program has gone off very, very well. We've been in the practice now of giving out over nearly $1.5 million a day for some time. We actually went through the monies that we were afforded the county. The state just this past week awarded us another $52 million. And I think to date, we're somewhere in the aggregate around 60 somewhat, 64 million. I'm not quite sure the actual number, but our partners, Catholic Charities and Council for Native Hawaiian Advancement, have worked very diligently, and we're real proud. In fact, it was a national ranking came up where Honolulu was the #1 city in the country. So I'm being told that 5,947 households, around 47 million. I actually thought the number was a little bit higher, but we feel pretty good about the pace that we're on right now. So just to be accurate, we've given out 47 million and quite a few thousand households. We're about to open up our portal next week, yet again for another tranche in anticipation of the moratorium being lifted. So we're doing everything we possibly can and feel good about what we are doing.
Thank you. Other mayors? Mayor Roth, did I see you on?
Yeah, we'll have to get back to you with the, how much we've given away at this time. We're still, we do have it stood up and I know it is working, but we've been working on other things this week to get an exact figure.
Okay, great. Any other mayors? All right, just reporters, just so you know, Dr. Char does have to leave within the next couple of minutes. But if there's one last question for her. Actually, she would like to clarify, and then I do have a question for you, Dr. Char. Dr. Char.
Thank you. So I think I misspoke earlier. So to clarify, it's 95% of the patients who are hospitalized are unvaccinated. I think I may have said something different earlier. So 95% of those who are in the hospital are vaccinated. If you look at, are unvaccinated. If you look at the breakthrough cases, typically if you are vaccinated in our state, 6 out of 10,000 are getting COVID. For those who are unvaccinated, it's more about 300 out of 10,000 that are getting COVID. So we know it works. It's a 0.06%. Vaccines work and they've been very safe for us in our community. Just one other thing. I really would like to thank the Department of Health team. There are a lot of divisions that have been working really, really hard on behalf of our communities. And I think the public often isn't even aware of how much we're doing for them. I just want to thank my team for really hanging in there and for sharing their efforts and their talents.
Thank you, Dr. Char. We did have one question for you before you go. This is from Daryl Huff, Hawaii News Now. Is it possible to explain the high breakthrough rates on volleyball clusters over 30%?
So I think in the cluster report, there were a couple of clusters tied to some volleyball teams that had traveled. If I recall correctly, there were about 13 team members and 11 of them tested positive. I think that's right. There were a number of players that had been fully vaccinated and yet came down with COVID. And I think what we have been seeing nationwide is that even if you are fully vaccinated, if you are in proximity to somebody who's infected and you're spending time there and you're not wearing a mask and you're just in proximity, it's kind of like you're being bombarded with COVID virus. And so the chances of you becoming positive for COVID yourself, even though you're fully vaccinated, are quite significant. So it gets back to, we know what keeps us safe. Wear your mask. We know that keeps us safe. I think we tend to let our guard down, especially when we're with people that we know, because we feel like, they're family or friends or whatever. But even if you're fully vaccinated, if you're with people that are positive for COVID and you spend a great deal of time with them and you're not wearing your mask, you are at risk for getting COVID. I think that's part of why the CDC changed the guidance to say that even if you're fully vaccinated, if you're exposed to someone with COVID, you should get tested about 3 or 5 days after that.
Thank you, Dr. Char. And we just have one more question for you before you go. Nicole Tam, KITV. Go ahead, Nicole.
Thanks, Dr. Char. Sorry, with the anticipated surge in testing, how does the state prepare to handle that? And are there enough locations and test kits available?
So we have been working very hard to make sure that we have lots and lots of testing available. Our federal partners have been sponsoring a program through FEMA. So I think on our website, if you go to the hawaiicovid19.com website, there's a link that's posted for each of the counties. And then also, I think it was CVS, Walgreens, and Health Mart or something like that. But there are places that you can go to get free testing, and you can click on it, and it'll pop up a map and allow you to sign up and go get tested there. It lists all the locations. In addition, we are working to add free sites around the state. we know that testing is really important, but we're not going to test our way out of it. But that being said, we want to make it really available and easy for people to go get tested. So we're definitely working on increasing the capacity in small pop-up testing venues, in larger, more permanent venues. It's kind of similar to how we did the vaccination.
Great. Thank you so much, Dr. Char. We appreciate your time. Dan Nicasso, Star Advertiser, you're next.
Thanks, Cindy. Similar questions for Mayor Belangiardi and Governor Ige. This applies to, we talked about unions, but applies to, I'm assuming, non-union people as employees as well. What is that total number of the workforce for the state and the city and county? And for the mayor, what's the estimate of unvaccinated of that population? And for the governor, House Speaker Psyche has ordered all House members and their staff and volunteer employees to similar situation to get vaccinated or face weekly testing. Governor, does that apply to elected state senators as well? Your proclamation.
Yeah, certainly, Dan. On the last question, I don't have authority over the legislative branch due to separation of powers. So the emergency proclamation covers the county and state executive branches. So all of the counties agreed to participate in the requirements. The University of Hawaii and the Department of Education as state entities also will be part of this vaccine protocol. So the legislature acts independently and the judiciary as well.
Thank you. We're going to try Daryl.
I think I need to answer Dan's question.
Oh, sorry. I'm so sorry,
City
Mayor.
and county. It's okay.
Yes,
Thank you,
Dan,
Mayor.
I think overall, on a broad number, the city and county employs about 10,000 people. But not unlike what the governor said earlier, it's really difficult, which is really the crux of the moment, actually, to ascertain who's been vaccinated and not vaccinated on an accurate basis. That's part of the angst going on right now of those people who have become quite uncomfortable, those people who have gone out to protect themselves and their families, receive vaccinations, and with the surge, not knowing who hasn't been vaccinated. But if we had to offer a guess on where we think we are, knowing that the state number is 75% of all people 18 plus at this point being fully vaccinated, we think we're at around the 75 or 80% number. And we probably have some number between 20 and 25% perhaps not vaccinated. That would be a guess, but that's probably a fair calculation.
Yeah, and then the state has probably 50 to 55,000 employees, more than that if you include part-time employees. The vaccination requirement would apply to all employees, civil service, temporary and part-time employees in the state government.
Thank you.
Stephanie Salmons, you're next. Go ahead, please.
Hi, this is for the governor. This is just another clarification. Will the vaccine mandate, will that also apply to employees of the Hawaii Health Systems Corporation?
I definitely will have to check on that. You know, they do have a separate board. They do have authority to oversee their employees separately.
Thanks, Stephanie. We'll get back to you on that. Kevin Dayton.
Governor, it would be super helpful if you could maybe walk us through sort of from an employee's perspective, what's required under this new mandate. Do you need to present a vaccination card? Do you need to present affidavits of both vaccination and exemption? And overall, who's going to oversee this? Who's going to make sure and enforce it?
Yeah, so just a couple of things. You know, the details are to be determined. Every employer is going to be working through exactly what the requirements would be. We would ask employees to show their vaccination cards, and their supervisors or others, the department personnel would be verifying vaccination status. and identifying those who are not vaccinated. And then we will establish procedures to begin the testing requirements. So those details are to be developed and implemented. As I said, each employer would be doing their part to implement the specific actions necessary to verify vaccination status.
Okay, thank you, Governor. Before we move on, reporters, I would like to let you know that Mayor Victorino has tried to log in, but he's been unsuccessful in getting into us. So I'm sorry that he's not been able to answer any questions for you today. Daryl Huff, we're going to try you one more time on audio before I read your question by text. Daryl?
Okay, can you hear me now?
We can.
Can you hear me now? You can?
Yes, you can.
Wow. I figured that out myself. Okay, so, with a huge number of cases, and I guess this is either for Mayor Blangiardi and or the governor, with a huge number of cases, don't you have any potential restrictions in mind that you might be considering? It seems like you've got community spread. You should have some kind of idea, even if it's not severe, of what you'd like to target.
I'll start, and Darryl, we have been talking and working with Libby and the epidemiologists to look at where the cases are and what would be the best way to slow the spread of the virus. Looking at the data, we see widespread community spread of the virus, and with the Delta variant, it is spreading throughout our communities. So I do think that we are committed not to implement across the board kind of restrictions because it does penalize those businesses and entities that have done a good job of implementing mitigation strategies. So we are trying to be very focused, and and we'll announce the measures as we come to conclusion. We've been talking about it for at least 2 weeks, and we'll be meeting on it again tomorrow.
Thank you, Mayor.
So if I might, Darryl, what we have now that we didn't have before when we were imposing restrictions is a critical mass of people who've actually been vaccinated. A lot of today's conversations about those that are unvaccinated, but we also have a very strong nucleus. In fact, as of this morning, we've actually administered 958,792 vaccinations. People have received at least one vaccine. So when you consider the fact that we have 211,000 kids in the state under the age of 12 who are not eligible, we're talking about a targeted population of around 250,000. So under this circumstance of those eligible to be vaccinated, we really want to play to the majority, if you will, from the standpoint of it's the minority that's been highly affecting the circumstance in this recent surges, as Dr. Char just testified to. So, in that regard, we don't see the need to impose restrictions given the critical mass of the number of people who have been vaccinated. The challenge here is that those of us that have been vaccinated, as we've learned, given the infectious nature of this variant, that we could actually be carrying as well and transmitting, which is unprecedented compared to the prior 2 strains. So that's really what's created the need to get everybody as vaccinated as possible. And that's what this is about right now. In talking to it, and I'm not the doctor, as you well know, but in talking to even the medical people, we feel we've got enough critical mass that we don't have to impose the kind of prior restrictions we had before. We just have to focus on getting people vaccinated.
Thank you. Next reporter is Manolo Morales. Go ahead, Manolo.
Hi, this is for Superintendent Hayashi. I'm wondering if you could give us an update on how distance learning is going so far and what has to happen before DOE shifts back to distance learning.
But currently, our schools and our complex areas are working very hard to support our students who have requested the distance learning option. Our state Office of Curriculum Instructional Design, has also implemented a distance learning program for those complex areas and schools that we're not able to stand one up. So we are working very hard to address the needs of all of the students who are requesting that option.
Thank you.
Okay, wait, I'm sorry. Can you answer the second part?
I'm sorry, what was the second question? Please repeat it.
What has to happen before DOE shifts back to distance learning?
There are several factors that we need to look into, and as time evolves, we'll be taking a look at different data points and working together with the Department of Health and in consultation with the Department of Health. And at that point, we'll be making those decisions.
Okay, very good. Our next reporter is Nicole Tam. Go ahead, Nicole. Nicole?
Sorry, I didn't unmute. But I have two school-related questions. So either interim superintendent or governor would be fine. The first is that if you're mandating employees to be vaccinated, why would you not mandate students as well? And then the second one is, how come high school sports cannot resume, but youth sports can? And for students who are vaccinated, they cannot resume practice.
Superintendent?
Oh, I'm sorry. Can you repeat the question, please?
The first one?
Yes.
Yeah, either.
Okay, so the first one was, if you're mandating employees to be vaccinated, why not do the same with children in school who are eligible?
In the core instruction, core public education, we do need to work together with parents to get parents approval, and so it's important that we do that. I believe that extracurricular activities like athletics is a choice for students to participate in, and as such, we're able to ask students to participate to vaccinate in order for them to participate.
Okay,
Governor,
and
Governor, I think Nicole, Governor's coming to the microphone.
Yeah, I mean, I do think that we look at what point we mandate vaccinations for students. As you are aware, we do mandate certain vaccinations for entry into school at both the kindergarten or preschool level, as well as middle school. And there's also a few requirements at high school too, right? So, I mean, we do evaluate whether we would require vaccinations of all students. We are looking at COVID-19 and we'll be making that decision as appropriate. We haven't decided at this point in time to mandate vaccinations for COVID-19 for students.
All right, reporters, we're gonna stop at 2, but until then, we'll keep going with your questions. It looks like a race between Daryl Huff, Dan Nicasso, and Kevin Dayton. And right at this moment, Dan Nicasso's hand is up. Dan?
Yeah, thank you. Thank you, Cindy. I appreciate that. Question is for a couple questions for Governor. Do you want me to wait till he gets to the podium?
Go ahead,
Okay.
Dan.
So weeks ago, Governor, before Delta variant had really taken hold, the plan was for, if we reach 70% vaccination rate, that all but all the restrictions would be lifted. Is that still the goal, or the CDC is talking about a 90% rate? Second question is, what is your message to visitors given the Delta variant and the concerns that are expressed today about what they coming here, what they should do?
Yeah, certainly, Dan, just a couple of things, right? The 70% was the State Department of Health's best estimate. You kept asking me for a specific number, and that's what we had determined for the COVID-19. Delta variant is very different and more contagious, and as you are aware, the CDC has been changing guidance in a number of areas. And so we continue to work with the CDC we are still setting that goal at 70% of our community, but we have learned more about the Delta variant, and we will be making adjustments as appropriate.
And reporter Dr. Char was able to stay with us, and she would like to respond. Dr. Char.
Thank you. So the 70% fully vaccinated was a number that we calculated that would give us pretty good protection in our community if we had 70% of our population fully vaccinated. And that was with wild type COVID when this first started a year or so ago. As we've seen the disease evolve and we've seen the mutations in the virus, we know that the Delta variant is so much more transmissible. And so, what percent of our population needs to be fully vaccinated in order to keep the rest of us safe? That's going to be a higher number. What exactly that number is, I don't know, but it makes sense that it would be a higher percentage of our population fully vaccinated before we have safety in our community.
Thank you, Dr. Char. Kevin,
Sorry, can I ask Governor that second question I asked about the message to visitors to Hawaii?
Yeah, you may need to repeat it, Dan.
Governor, what is your message to tourists coming to Hawaii, given your comments today about everything in terms of state and county workers and whatnot?
Yeah, certainly, the message we do have for tourists is, you do have the option of visiting our islands. We still continue to see strong demand for visitors coming to the islands. Although we have seen an increase in the number of travel-related cases, the majority of travel-related cases involve residents who travel and return to the islands. There has been an increase in the number of cases tied to visitors visiting the islands, but it continues to be a very low percentage of cases.
Right. Thank you. Kevin Dayton, we're winding up. See if you can get your question in.
You bet. Governor, just a quick question about UIPA. Will your newest proclamation or proclamations reinstate the UIPA in full?
I would definitely have to check on that, Kevin, and get back to you. I know that we've been working very hard to narrow the UIPA exemptions to essentially stop the exemptions. I think the latest draft of the requirement I would have to cover, but we talked with agencies having to comply with UIPA, but justify why they would not be able to because of the pandemic. But I can get back to you on that. We will definitely go through and provide you a specific response.
Okay.
Thank you.
We do have a newcomer to the questioning here, Jason Ubay. Jason?
Hi, this question is for Dr. Char. Is there any indication that travelers from the continent who are vaccinated, since they're allowed to come in, is there any indication that they are carrying the, infected with the coronavirus and testing either when they get here or when they return back home?
So I believe the question is related to travelers coming to Hawaii and manifesting COVID infections. As Governor noted, the vast majority of travel-related infections, we're seeing it in returning residents. We have had a small number of cases in the travelers from the mainland, and we've had cases of transmission or they test positive when they're here. I'm not sure if they were infected before they flew here or they got infected after they arrived. But by and large, it's returning residents where we're seeing our travel-related infections.
Okay, thank you. Daryl, I'll give you the last question for today. Garrett, go ahead.
Thank you so much. So what I need to get clarified on is what your intention is when it comes to the exemptions. You mentioned religion.
Daryl, sorry.
Yes.
Who is your question for?
Oh, the governor and Mayor Kawakami.
Thank you.
What's your intention when it comes to the exemptions? Because Mayor Kawakami indicated that you could opt out to testing. Is that possible to do without a religious or health exception? That is, will you give state workers the option of just opting out to testing without those exemptions?
Darrell, I do think that every employer would be implementing the vaccination requirement as they believe is appropriate in their county or for their employees. And so some would be very specific and limited in their restrictions, and others might be treating it differently. The goal is to ensure the health and safety of the employees as well as the general public. We want to encourage everyone to get vaccinated, and we recognize that there will be exemptions.
Mayor Kawakami?
Yeah, Darrell, you know, in our eyes, I mean, this thing has been painted and promoted as a mandate. It's really not. We're giving options, right? I mean, we're doing our part as public servants to navigate this community through very challenging times, and we're giving them the ability to opt into getting a vaccine and becoming fully vaccinated, or opting into getting tested regularly. But then in the same breath, we're trying to make it as easy and convenient as possible, no matter what route you take. We're not asking for any exemptions as far as religious or health. It's just our associates have choices to make. And they are the least disruptive choices for the type of intervention that is required to start getting this ship sailed in the right direction, because there is a serious concern about the sharp uptick in cases. And, you know, Kauai has said it before, our healthcare system is very limited, and we've been dodging some bullets. You know, as we speak today, our healthcare system is strong, but it just doesn't take much to tip it over the edge. So that's what I meant when opting in. You have choices to make.
Thank you, Mayor.
Thank you.
I'd like to note that we've come to the end of our time. I thank the mayors and Dr. Char and Superintendent for their participation. And Governor, any last words for us?
No, just would want to thank everyone across the state for helping with COVID-19. Want to encourage everyone who is not vaccinated to get vaccinated. State and county employees will be required to get vaccinated or submit to weekly testing. We think this is an important step to move our communities forward. And certainly, I think the quicker we get everyone vaccinated, the quicker we get back to normal. So thank you so much for being here today.
Thank you, Governor. This
Thank you.
concludes our conference for today. Thank you.
Thanks, Cindy.